of having alopecia is getting bullied sometimes, and sometimes people can just comment out loud, especially the littles, and they can point and they can stare and they can ask you if you're a boy, and sometimes that cannot make you feel so well. So it's just a little uncomfortable having alopecia for some kids, but for some kids they actually like having alopecia just like me. So it's actually awesome having alopecia.
At first, when she was diagnosed at 2, it was hard. We didn't understand what was going on, and waking up and finding your child with clumps of hair on their pillow, which as a parent you were extremely concerned. But then we sought help. We went to the National Alopecia Foundation. We talked to our wonderful doctor, Dr. Mancini, who gave us resources and connected us with people to let us know that we were not alone. I think it's amazing. I feel alopecia, there are so many unknowns. There are no known cures. And for our family, Rosie has decided not to participate in any sort of trial or any medicine. So for us, the way that we can feel like we're being educated and understanding about this disease, it's important for me and for Rosie to understand what research is out there, what's on the horizon, and kind of providing support to researchers in their quest to kind of uncover this black box of a disease is kind of empowering, because it makes me feel like I'm doing something, because I feel so helpless as a parent with this disease.
There's nothing quite like it. I mean, look at Rosie, right? I think all of us went into medicine because of patient care and having, a connection with families and patients and support organizations it really helps remind us why we're working hard for what we're working for. Because ultimately at the end of the day, it's about them and it's about their quality of life. And I think it's really rewarding to have kind of the back and forth that we have, not only within our community, but also with, all these other players in the scenario. And I always tell my patients, I learn just as much from them as they learn from me. I think that's really true, probably sometimes more.
And I think as a parent, I would love the researchers to give people with alopecia a choice to be treated safely, or a choice just to be who they are.
We are in just like an explosion right now in terms of therapies for a disease that traditionally has been really kind of without a reliably effective treatment. So we've learned a lot from basic science in terms of the key parts of the immune system that are involved and how these cells communicate. And as it turns out, there are medications that actually target those pathways that are sort of overactive in alopecia areata. So the first patient with alopecia areata to take one of these medicines was reported just 5 years ago. And in that time, there are now multiple clinical trials, lots of papers in the literature. We're learning more and more every day. And I think, while there's still a long way to go, I think in another 5 years, these things are going to be much more readily accessible. Hopefully we'll be able to treat younger and younger patients. We'll have a lot more kind of long-term data about side effects and things like that, because it's true. We want to make sure our treatment is something that's not only effective, but safe. And I think for right now, even though, they're not super readily available, there's a lot of hope now for kids who maybe aren't as comfortable as Rosie is and their parents, and knowing that, look, maybe we can't use it right in this moment, but 5 years from now, it's a real possibility. And I think, just having hope is huge.